You should be kind to everyone and be patient with everyone.
The longest I didn't speak was 4 months, and the longest I've been paralysed has been a day.
And even when I was told that this was a disorder, I was told it was a disorder, but it was in my head. So even the neurologist that gave me the diagnosis basically gave it to me and said, well, you know, you've got a disorder, but so that's difficult.
Hi, I'm Catherine. I'm 36 and I have functional neurological disorder, or FND.
Hi, my name is Jess. I'm 26 years old and I've been living it with FND my whole life, but I was only officially diagnosed last year in December 2020.
Hi, my name's Carson. I was diagnosed with FND at the end of September 2020.
I've had it for nearly 18 months. My symptoms started suddenly and I was diagnosed straight away.
What FND is, it's functional neurological disorder, and basically it is your nervous system misfires information from your brain to your body. So it is a nervous system disorder. It is definitely in your body and your body is not working properly.
My symptoms include seizures, tics, tremors, speech difficulties, anything from no speech at all to whispering speech or stammering or completely fine. I have episodes of paralysis, limb paralysis and weakness, tremors, did I say tremors? Dissociative episodes, drop attacks, lightheaded, dizzy spells, pins and needles most of the time, and brain fog and chronic fatigue all the time.
The symptoms that I experience are numbness all the way down my right side of my body. I've also experienced extreme fatigue, health anxiety, depression, generalized anxiety. My most obvious one is my eye that I cannot open. We've also got tremors throughout my body, non-epileptic seizures, blackouts, weakness in limbs. Sometimes I lose the ability to talk. So there's loads of different ones. It just depends what kind of a day I'm having.
Some symptoms I experience include muscle weakness, dizziness, fatigue, pseudo-seizure, muscle spasms, facial weakness, chewing and swallowing issues, speech issues, and that's just a few.
I had treatment about a year ago, inpatient neuro rehab for 3 weeks, where I learnt tools and techniques for calming the body and mind. I had speech therapy, physio, occupational therapy, psychological therapies, neuro-linguistic planning, NLP, and mindfulness sessions.
In terms of treatment, we did physiotherapy, and now that I've graduated out of that, we are also doing occupational therapy, and my treatment team thinks in the future I will probably need vision therapy as well because my eyes shake from time to time.
The treatment usually includes physiotherapy, psychological treatment, and then if there's any medication that could help a specific symptom, they will also treat you with that. Now, my specific treatment is just with a clinical psychologist, because my physical symptoms are not a constant. I wouldn't need to see a physiotherapist. So I'm seeing a clinical psychologist, and we're doing work on sort of any psychological stresses, because psychological stresses can make symptoms worse. Basically, if anything is weighing particularly on your mind, it can essentially make your nervous system and the brain misfire a little bit more sometimes. Not everyone's brain works that way, not everyone's nervous system works that way, but in my case, it does. So we're working through that to see if potentially we work through some stresses, my eye may open.
And then I am seeing a therapist, so I'm also receiving psychological treatment. So my treatment is basically kind of looking at the whole picture.
Challenges that I experience sort of range from the fact that I don't have my right eye. That was really challenging for me in the beginning. I mean, I still bump into things all the time now, but it's more not just the fact that I can't see. The fact that I have no feeling means that I don't have that instinctual feeling either. When people come up behind you, you usually have that instinct to turn and look. I don't have that anymore. I have absolutely no feeling, no neurological instinct on my right hand side. So it becomes very difficult. If anything happens on my right hand side, I don't know. So there's lots of bumping into things, not realizing people are there.
Some challenges I face from FND is that the symptoms are unpredictable, so you can't really plan because you don't necessarily know how your symptoms will be like on a certain day. And that's kind of hard.
The hardest thing about living with FND is the lack of control over my body, not knowing what symptoms are going to appear and when, or for how long, or how detrimental they'll be. And that's a challenge.
I've got a lot of sensory issues as well, which is another symptom. And so I have already very sensitive eyes, but now I only have one eye, so it's extremely sensitive. So when I'm going out, I had to get special sunglasses. I get oversensitized if there's too much light, too many people around, too much noise. So I've got to carry around earphones. So there's things like that, challenges like that, where it's also, I don't like to leave the house now, in terms of, I know it's a weekend, I know loads of people are going to be out, so I'd just rather not leave the house, in terms of, I know I'm going to get oversensitized. So that's just one example of a challenge.
Additionally, it's hard seeing like the body gets like fatigued so easily, and then you can't do the activities that you used to love to do, and then it's hard seeing that you've like lost so much and you don't know if you're going to get it back or not.
And the impact on my mental health that it's had has been quite difficult. I can mostly accept the physical symptoms that I have. I'm all right about it. I'm able to cope with what that throws at me.
The hardest part about FND for me is the fact that for 24 years, my mother and I have been told that I was a liar, I'm hysterical, I'm a teenage girl that's looking for attention, and there's nothing wrong with me. And that's the hardest part, because they couldn't find anything physically wrong with me, nothing on the MRI scans, when I knew that there was something wrong with me, because I was experiencing pain, I was experiencing seizures, I was experiencing blackouts, I was experiencing all these different weird, wonderful things, but I was being told that I was a liar. So that's been the hardest thing for me.
I view my symptoms as temporary. I just don't know how long they're temporary for. The mental impact has been massive. The chronic fatigue that I live with is really difficult, and that is permanent.
I wish people knew that I'm trying my best and just be patient with me. Like, all I'm asking for is patience.
What I want people to know is FND is one of the biggest neurological disorders that send people to an actual neurologist, an outpatient neurologist. People don't know about it, they haven't heard about it, but there's loads of people out there with it. And the problem is there's a lot of doctors, nurses, clinicians that just don't have the appropriate training for it. So they're treating us this way because they're not made aware of it. And I think that there needs to be more training, there needs to be more research about it. So that's what I want people to know.
Really wish that other people knew that although I might appear symptom-free today or look okay, the FND is still there. It's not gone anywhere. I could be really struggling on the inside, and I don't know what's around the corner, and that's really difficult.
Life is tiring. The fatigue is constant, and I always live in a state of shadowy darkness. Apart from today, I thought I would get the sun out.
Life with FND is definitely different. I get to see life from a different point of view than able-bodied people would, because there are like struggles from day to day that I wouldn't necessarily tell able-bodied people because there is no need to. But then it does show me that no matter who you are, everyone has some struggles of their own. Whether or not they show is another story.
It was very lonely in the beginning, but once I decided to learn and increase my knowledge about what was happening to me, what was happening to my body and my mind, and my brain, my nervous system, things were not as lonely anymore, because once you start to realize that you have no control over this and you reach out to people who have similar symptoms as you, life gets a little bit more interesting. So at the moment, life is slow, it is tiring, but it is getting slowly back to normal because I found a group of people online that I can relate to. You've just got to take it one step at a time and take your medication. Make sure you take that time to recover if you need to recover.
I'm hopeful. My family are super fantastic, and we've made loads of adjustments and continue to make adjustments, and I'll be okay.
Have a read about it. Let's spread the word. Let's get a bit more information flowing between friends, between family, between groups of people, because the more people know, the less our actual medical professionals can treat anyone with any diagnosis with the least amount of respect.